Welcome to this adult education senior university session, The Empowered Caregiver, Responding to Dementia-Related Behaviors. The presenter for this session is Linda Curley. Linda is a Lake County Purdue Extension educator of health and human sciences, and she is also a community educator for the Alzheimer's Association. Thank you so much for joining us, Linda. I will go ahead and turn it over to you.
Thanks so much. So as she mentioned, my name is Linda Curley. I work with Purdue University Extension out of Lake County, but I have a partnership with the Alzheimer's Association just because I don't know if you all know this. If you've been on the sessions with me before, I certainly have mentioned this, but Lake County has the highest incidence of Alzheimer's and dementia than any other county in the state of Indiana. And so when I have to do some needs assessment for communities, I usually try to see where need is greatest and partner with agencies certainly that we can get information out to all of you to support what it is that's going on with you and your families. As a caregiver, I'm sure that you have lots of questions. And Amanda was great to bring in this 5-session series. So many of you may not have been able to join us, and Amanda, again, has recorded those. So if you'd like to go back and look at them, Amanda is your contact for that information. So as we present today, I want you to think about your situations as a caregiver, because I will give you some scenarios throughout the day today. But we do ask that you kind of absorb it as though it is the person that you're caring for as well. And also know that it's so easy for me to flip through slides and give you tips and pointers. But every one of you has a very different situation going on in your household, whether it is the stage of dementia that the individual that you love and care for is in, or whether it's that from one day to the next, you're not sure what to expect. So hopefully we can help you with that. At the end of the presentation today, you'll have, and Amanda has already sent this to you. If she hasn't, she'll be sending it soon. It's just a handout for you to work through yourself in terms of what's happening in your own households. And certainly we hope that that's supportive for you as well. So without further ado, the topic today is responding to dementia-related behaviors. And as I said originally, many of these scenarios that we provide you in the presentation today, they may work one day and they may not work the next. But we certainly want you to kind of have some idea of what is working and how you can maybe capitalize on that in order to support the work that you're doing as a caregiver. Okay, again, responding to dementia-related behaviors is our topic today, and let's look at some of our learning objectives. So we want to describe for you how dementia can cause changes in a person's behavior. And person's behavior is a big part of this. An individual that's been affected or diagnosed with severe cognitive decline, dementia, Alzheimer's, these behaviors aren't something they want in their lives, or they're not necessarily something that they embrace. But oftentimes there's frustration involved with how they can communicate with you. And so we'd love for you to think about these behaviors very separate than what the person's real intention is. We also want to list some possible triggers for dementia-related behaviors. I'm going to give you an example here. Let's say that I have dementia and I put my keys on a countertop, but a caregiver comes in during the day and moves those because she's dusting or he's dusting and puts them elsewhere. And so this individual says, I know I put my keys here and they're not here any longer. And then the next day after, you find keys and so forth, an individual puts keys in a place that he or she thought they did when in fact they really put them elsewhere. So now here's 2 scenarios. Keys were moved in the first incident, and the remembering of where keys were put in the second scenario is difficult for an individual as well, because they start distrusting people around them to say, who's been doing this to me? Who's moving things on me? Is somebody coming in this house and taking my things? And so again, These probably are irrational thoughts to you, but for that person who is suffering from the disease, these are things that come into their mind and they think about them this way. We're also going to compare non-medical versus medical ways to address behaviors. We certainly would like you to exhaust all options you have in terms of non-medical versus medical ways, but perhaps even an individual is taking some medications that don't interact with one another well for them. And so that's worth a conversation with a healthcare provider. And then finally, we're going to go through in depth this idea of explaining this 4-step approach for managing behaviors. And hopefully the scenarios that we present to you may be something that you can turn around to evolve into maybe some experiences you're having as a caregiver in your own environment. So let's look at the understanding of behavior changes first and foremost, okay? So what is a dementia-related behavior? So it's like an alarm telling you that your needs aren't being met. The examples might be feeling unsafe or uncomfortable. So I gave you a scenario a few minutes ago about the keys. And you can imagine an individual feeling unsafe when they can't make heads or tails of what's going on with these keys. Is somebody coming in to the house in the middle of the night and taking my keys? I would feel unsafe if I had questions about who is in my environment and how familiar I am with them. Or maybe I'm just feeling really uncomfortable about a sweater that I have on for the day and the tag is bothering me and it's itchy and I don't quite even know how to capture what's going on to explain it to my caregiver. So there might be some restlessness, there might be some dementia-related behaviors there that are unexplainable to us because we're working our hardest to get things figured out and this communication barrier exists, right? Behaviors are not always the same, so a person may have good days and bad days, and I kind of tried to explain this on the front end of this conversation today, that what may work for you one day or one facial expression that you get from somebody might be this idea of you saying, oh, I saw that facial expression yesterday and this individual needs to use the restroom. This is what I'm getting from it. Maybe the next day it might be a facial expression for something very different. And so we kind of have to have some patience there to try to understand the situation without kind of blowing up, right? And then the person living with dementia often cannot control their behavior as well. And hopefully we can look at some scenarios here that will help you to understand that a little better. All right. So what causes these changes in behavior? So remember that currently Alzheimer's is not a curable disease, and the disease causes brain cells to break down. And as these changes happen in the brain, it makes it harder for a person to understand the world around them. And while it's hard for a caregiver to say, well, that's a simplistic idea, I don't know why we're not communicating well. It's often because the brain these cells have broken down and these connections are broken for this individual to find a clear path to the answer or the solution to the problem. The person also may have trouble knowing what's real, what's safe, and what's the right thing to do. So we will look at those things in the course of our presentation today. So we're going to hear from an expert or two right now throughout the session. And we're also going to be hearing from people who are caregivers like yourselves, who have been experiencing things and maybe some solutions that they have found for themselves. So let's give this a try.
The changes in the brain that occur with Alzheimer's and other dementias then can impact on somebody's cognition, their functioning, and also their behavior. Now, these changes aren't consistent over time, but they can vary. They can vary day by day, and then they can also vary as the disease progresses.
Individuals living with dementia can have trouble understanding the world around them. And unfortunately, that could lead to them not knowing what's real, what's safe, or what's appropriate. That uncertainty then sometimes leads to dementia-related behaviors.
Yeah, so if we can keep those ideas in mind that this person really isn't trying to cause trouble or cause you trouble or an extra burden, it's that their mind is really kind of playing tricks on them and they believe things to be true that perhaps are not true in these scenarios. Okay, so let's look at behaviors as a form of communication. Oftentimes, behaviors manifest because folks are trying to explain things to you and they're really having trouble with that. So, people living with dementia react to what they think, feel, or need from the people in the world around them. These reactions are forms of communication. So honestly, I could be looking at the group of individuals in this room right now, and I might point off to the side, and you'd say, "Oh, what's she pointing at?" Right? So that was a clear bit of communication that I used through my body, but I didn't have to vocalize that to you. But I also am clear thinking right now. So oftentimes the communication is broken down simply because an individual might not be clear thinking, right? So caregivers have to connect with a person to figure out what it is that they're trying to tell them. So again, you might look at past experiences, and we'll dive into this a little bit more. But really, even when you are caring for someone you love and have spent some time with, you kind of know those things that traditionally they liked or didn't like, the tastes that they had preference for. And so even kind of reaching into your own brains to say, they like to do this before, let's see if this will help now. And then these behaviors are not related to a person's true feelings about you or other people, so try not to take them personally. And this is very difficult, especially when you're in the throes of it and you're doing your best to manage situations. And it seems like they come at you kind of fast and furiously. So it is important for you to remember it's not about you or how a person is feeling about you. It's this dementia that has taken over things. All right. So let's look at some of these common behaviors. First and foremost, we have anxiety and agitation, aggression and anger, suspicion and delusions, and then getting lost and wandering as well. Let's listen to a caregiver in her own voice talk about some suspicion that her mother had in reference to her scenario. Let's listen to her story.
My mother did experience some degree of suspicion, and this is a rather long and involved story, but my name is Freddie James. My father's name was Fred James, and shortly after he died, my mother accused me actually of stealing some money, of going to the bank and actually using my father's name and my name, the similarity, to take some money, which absolutely had not happened, but this suspicion had developed in her mind. It took a lot of patience. It took a lot of explaining, but eventually it just took letting the situation die down, not getting too involved in it myself. In other words, not reacting in anger, not reacting with a lot of emotion, but just allowing her to work through the process.
And that's key here. This idea of not letting your emotions get incredibly explosive, really kind of settling in on the fact that there's obviously a mistake here. And so let's let this settle down instead of making accusations back at that individual. Let's do a knowledge check here. Wandering only happens in the early stage of the disease. Is this true or false? It is false. So wandering can happen at any stage of the disease. In fact, 6 in 10 individuals with Alzheimer's will wander at some point during their experience with you. So they may wander down the block because they remember a pet that, that they enjoyed being with. Or sometimes they remember their own pet that is no longer living, and they're looking for them to say, why isn't he or she in the house right now, and do some wandering. So again, it's not always an intentional thing to scare you. It's just that their mind is telling them something very different. Let's look at some triggers, and many of you probably have heard of the term that sundowning phase, when folks get a little bit more irritable. You might have, it's around that dinner hour, 3, 4, 5 o'clock. Just know that this experience often comes from sleeplessness for the individual who has been diagnosed with the disease. Perhaps they're not sleeping well at night, so now their internal clock is a little bit off. And so when we get to that time of the day, it seems like they're just incredibly tired of thinking so deeply into things and communicating with lots of effort and maybe not even getting back what they had expected. You talked about this last time I was here. That's a difficult time for everyone. And everybody tries to pitch in, and oftentimes it even makes matters worse when there's more people involved in all of it, okay? So we have some different triggers here. We have things like external triggers, and we have things that are internal triggers. So in this case, they are mentioning things that are physical, like pain or discomfort, or even their unmet needs. Maybe they really have to go to the bathroom, but mobility is an issue for them, and nobody is getting their prompt that I need to get up and go, I need help. And so there's some physical pain and irritability with that, okay? Socially, there's an external behavior, and this may include being around people who stress them or bother them. Okay, so maybe you decide that you're going to take care of grandchildren for the day, and you're in a sandwich. You're caring for somebody that's either your spouse or an older adult, and you're taking care of young children, and you're kind of sandwiched between, and you say, well, the best scenario for me is to have everybody under one roof, so I have eyes on everybody. Well, that can be a commotion that can be really bothersome to an individual who really has gotten used to quiet and calm, and it's an explosive situation for the day. So even kind of knowing that on the front end and saying, I need help today. I can't do all these things by myself today. Someone else needs to take the kids in the other room, and maybe I can manage what's happening in here, okay? Environmental, this is when things happen around a person that cause stress. So maybe it's just really hot out. Maybe you've turned on the ceiling fan because you think you can, release some of the air and get some airflow from the cooler day that's outside, but something is blowing on this person now, and they don't have the proper coverage on their hands and so forth. So maybe they just need a blanket. Maybe that's the only difference here. And then personal are internal needs that need to be met. So maybe the person is experiencing some feelings that are unfamiliar to them, and they don't quite know what to do with these feelings, and communication is difficult for them. Okay, so let's look at some non-medical approaches to dementia-related behaviors, okay? And so when we think about non-medical approaches, they should always come first. And I said this on the front end of our presentation. We always want to look at what we can do with non-medical approaches until we've exhausted them, and then reach out to a healthcare provider. And honestly, when I talk to folks who are experiencing this as caregivers, when they go for a visit with their loved one to a doctor, oftentimes a doctor will ask you these questions like, how are you doing as a caregiver? And, what kinds of things have you been working on to manage some of these dementia-related behaviors? And oftentimes the caregiver, if they realize that you've almost exhausted everything, they might make some suggestions for you. And it really could be just the adjustment of medications they're currently on, right? So it should focus on giving physical and emotional support. The approach can help identify the needs and meet the needs of the person who has trouble expressing him or herself. And use what you know about the person. As I said a few minutes ago, perhaps you're trying a new food with them and they liked it in the past, so you think, okay, let's try it again. But maybe that food doesn't feel right in their mouth anymore. Maybe it's too squishy, the texture isn't what they thought. Maybe their olfactory senses aren't sensing the flavor as they once did. So again, kind of swapping things out and making a note, that food didn't work so well for me last time. Either I give it to them in a different form, cold, or uncooked. If it's a veggie, maybe it's, chopped up that way, or maybe it's not mashed. Maybe it's a whole vegetable or fruit. So think about those to reduce these behaviors as well. So let's look at this 4-step approach to addressing these behaviors. And here are the 4 steps. Detect and connect. So at that point, you're saying, I detect something is off here, and try to connect with the person as best you can to kind of get ahead of what could be coming next, okay? Make sure you've taken care of the person's physical needs. So kind of go through a checklist in your mind. Like I said, are they fed? Did we get the restroom taken care of? Maybe they've been constipated and you're not thinking that that's really uncomfortable to them. Maybe they have a UTI and you're not sure about that either. There's lots going on with individuals for us to think of. Help them with their emotional needs too. So maybe they are feeling insecure, like somebody keeps taking my stuff. Even having a conversation about that is great, okay? Saying, you know what, I think I'm going to walk around the house and check the doors and the windows just so I feel safe. So you just turned it on yourself. And this person is hearing that saying, okay, this is the way I was feeling too. I just didn't know how to say it to you, okay? And then review and plan for the next time. What worked for me? What didn't work for me? I know in my heart of hearts that this isn't going to work every single time, but I'm sure going to use this as my go-to as I try to iron some of these things out if this happens in the future. Okay, so let's look at that detect and connect. Use what you know about the person and try to understand their needs and feelings. Join the person in their reality. It will help you understand what they are trying to express. So if a person says, I feel like somebody's coming in the night, you can say, as I said to you a minute ago, okay, I understand. I'm going to go around and check all the doors and windows and make sure we're safe. Okay? Approach the person calmly and quietly and with respect as you figure out the situation and build that communication, and then avoid correcting a person. So if an individual says, I'm really feeling sad about the loss of so-and-so, and you say, well, that happened 25 years ago. Why are you revisiting that now? It will only make things worse, okay? So instead of correcting a person, just kind of go along with it. It can be very helpful. Okay, and then ask yourself these questions to identify the need behind the behavior. Who was there when the behavior took place? So again, was it a room full of children that usually isn't in that room? Was it that you were in a new environment with this person, you took them out to dinner because you felt like you needed a little bit of an escape and all of a sudden things broke down there? What happened just before or after the behavior? So was this person anticipating in their mind because that's what they've experienced? Or what happened before so you can say, aha, that door slammed shut, and then this person really reacted to it in almost an unrealistic way. But in your mind, again, you're going to jump into their reality and say, that door probably scared him or her. Maybe they interpreted it as something different than a door shutting, okay? When does the behavior usually happen? So is it early morning, late afternoon, in that sundowsing phase, during the middle of the night? When are these things happening? So that you can kind of see the time of day that you might have to have a heads up that this is a sensitive time of day for this individual. Where did the behavior happen? And then finally, how did you react to it? So kind of make a note for yourself. Honestly, at the end of our presentation today, I'm going to go through the handout that I mentioned on the front end here. And many of these questions are embedded in the handout so that you can take a stroll through them and perhaps figure out some situations happening in your household. Okay, number 2, take care of physical needs. So like I said, check what the physical discomfort might be. Maybe the person is wearing really uncomfortable clothes that day. We're changing seasons all of a sudden here, which is a little early for me, but now all of a sudden we're putting extra layers on and so forth. So maybe that might be the problem, okay? Maybe there's too much going on in the room. Again, maybe the person is even sitting in a position for too long and they're just uncomfortable in the chair that they're in. Maybe they need to look at something new. And certainly contact the person's doctors about any signs of pain or medical problems that are happening, because actually you may have been away and another caregiver may have been with this individual and maybe they fell and they actually really hurt themselves. And you're just not detecting it because nobody reported it to you. So just make sure that this person is in fact okay if something like that happened. Number 3 is to help with emotional needs. So focus on possible emotions instead of the facts of a situation. So offer comfort. Okay, so a person is feeling unsafe, maybe to touch them or to embrace them softly, to say, I'm here, we're safe. I'm going to keep you safe. And so together trying to make a person more comfortable. You can redirect their energy into more relaxing activities. So you can say things like, I know you love to do jigsaw puzzles. I'm here with you. We're safe. Let's try something different. Let's keep our mind on this right now, okay? And if you don't respond to things, if they don't respond to the things that you're trying, let that go and try another approach at another time. Sometimes just letting things go is a good idea too. So there's a couple of ideas here in this one block. Finally, review and plan for the next time. And what this means here is figure out how you move through the difficulty. Did it go well? Did it not go well? Pick it apart and see what perhaps can help you later on. And again, if you do have somebody that's coming in to caregive on your behalf or while you're out at the grocery store or whatever, maybe share some of those things with them as well. Okay, so what are the warning signs that the behavior may be coming back? Did you notice something on the front end that they started to do? Maybe they got restless. Maybe they had an odd look on their face. Maybe they were looking outside like something was happening out there, whatever that might be. What responses work well and in what order? When did you need to respond? What worked best? How can you tell if your approach worked? And who else can help you? And that may be somebody from your care team. It may be a doctor or a care provider. So let's look at some real life examples with this 4-step approach in mind. So let's look at anxiety and agitation first. So here we are. Situations that cause anxiety and agitation. Maybe moving to a new residence, such as a nursing home. Maybe it's changes in the environment like travel, hospitalization, or even a house guest in your house. So I like to tell this story. A woman shared this example with me. I've been doing these sessions, these programs related to Alzheimer's and dementia for quite a few years. And one of the women said that her husband was in early stages of dementia. And every year, his 2 or 3 brothers had kind of a little get together at one of the houses. They would go out to eat. They might go bowling. They all stay overnight together and reminisce about their younger days. And then everybody heads back home again. Well, since he was in such early stages, she felt like, he can make the decision whether he wants to go or not. I don't want to hold him back, So he said, I want to go. I want to drive there. I'm doing really well. Absolutely. I'm excited. And, they talked on the phone about it and so forth. So off he goes. And I think, probably a couple of counties over from here. Okay. So I don't want to get real specific because this is somebody that perhaps and I don't want to get real specific here, but a couple of counties over this individual drove, all right? He got there, the day was great, everybody did whatever they did, they went to a restaurant, they did some activities together, but it wasn't till the nighttime when he needed to lay down in a different bed than was his own. It was dark, there was probably shadows in the room. You just didn't have all the things next to you. Plus, when you drift off to sleep and you wake up again, even if you don't have dementia, you kind of have to find your bearings again, right? So he really had a tough time through the night, to the point where his brothers called the wife and said, we're going to drive him home. We'll take his car with us. Both of us will drive him home. We need to drop him off. He's just not comfortable here. So kind of out of the blue, just this agitation developed, even though he was sure he was going to be okay. So again, in your mind, you think of this individual saying, he didn't intend that to happen. He even had no idea this was going to happen. You don't plan these trips with this intention. So if you can kind of keep that in your mind to say this, and it's not about the individual choosing to do this. It is what's going on in their mind at the time. So even changes in your caregiver arrangements, somebody's unfamiliar to them, it's not you anymore, they look a little bit different, and oftentimes that can be startling to someone. Believing that something is a threat. And I know I keep going back to this loss of objects, but oftentimes people really do feel that someone's stealing from me. They're coming in this home and stealing. So what if you opened up your wallet right now and you thought you had $40 in there and it's completely empty? You'd really go through your mind and say, oh my goodness, did I spend it somewhere? Did I give it to someone? Where is it? And so somebody in having dementia might look in their wallet thinking they had $300 in there and there's nothing there. And then they really start wondering, who took it from me, right? And then feeling afraid or tired from trying to make sense of the world around you. So when you're working on a difficult problem, even some of you might recall when you were in school and you were working on some difficult problems and you said, I'm exhausted, just trying to think this through. Think about an individual who's doing that 24/7 and really appreciate what it is that's happening with them. All right, so let's give you some scenarios. As I mentioned a few minutes ago, Eugene is living with dementia. He lives in a quiet apartment with his daughter, Denise. Eugene spends most days in the living room doing jigsaw puzzles. Denise's sister and her young children visit from out of town. The kids are noisy and running around the apartment. Eugene looks anxious and does not want to come out of his room. So how could Denise direct and connect with Eugene? So if you could look at my 1, 2, 3, 4 there, right underneath this slide, select the 3 best tips that apply here. Should we try to see the situation from Eugene's perspective? Think about when Eugene's behavior started. Considering if having noisy young children in the apartment is making Eugene feel anxious, or get angry and assume Eugene is just being difficult. I'm going to click those off. When I first looked at this slide, though, this get angry and assume Eugene is just being difficult, that's not unreasonable for some of us to think, though, right? And react to it, right? So you might say to yourself, well, who would do that? We all might do that, right? I'm tired of this. I'm tired of your shenanigans. Get with the program. That's not going to help, right? That's not going to help at all. So what we're trying to do with you all today is look at real life situations, kind of avoid those things that we might be our traditional go-tos. And so it's not unreasonable for us to get angry and assume he's just being difficult, but that's not what's happening here. And so it's important for us to look at this, look at step 1 when we think about detecting and connecting and say, there are better ways to handle this. And I have to say, even in a small apartment with young children with no one having dementia, that's a tough sell, isn't it? They don't have enough to do. There's not enough space. So that's a tough scenario anyway. Okay, so that was our answer and we did well, right? Okay, so let me move on. And we're going to look at aggression and anger. Okay, so as I mentioned, this can include physical discomfort, environmental factors, and poor communication. So we've got some things that are external, some things that are internal that we need to be thinking about here. So when you look at step 2. When you look at aggression and anger, think about all the other things that can be part of this scenario, okay? And we're going to look at taking care of physical needs, which is step 2. So here it is. Sonia is living with Alzheimer's. She lives with her son, Hector, who hired a home care aide to help with Sonia's needs. Recently, Sonia has been yelling at the aide during bath time. Hector recalls the aide telling him last week that Sonia fell while getting out of the tub. So there are some key points in here. Let's look at the questions on the next slide. How can Hector take care of Sonia's physical needs first to address her aggression? So if you want to tell me which ones you would select here, 1, 2, or 3, we'd like you to select 2 of the 3 options you have. Okay, so let's check 1 and 2, and we'll see how we did. And pop that in there. And again, that was correct. So hiring a different aide isn't necessarily going to help because the bathroom situation is still there. You could roll 5 people in, and because you fell in the bathroom, that's what's sticking in your mind. And you might have really hurt yourself and injuries weren't checked out. I know that if I slipped in the tub, every time I go in the tub, I'd be much more careful about my experience in there. And it would trigger a memory of a fall. So why wouldn't this be a reasonable expectation in this situation? So this is another reason why it's really important that if you have multiple caregivers, that everyone is communicating with one another about what actually happened during the course of the day. Even though you might think it's insignificant, it could be the key to unlocking problems in the future. Okay. All right, let's look at suspicion and delusions. Okay, so situations that can lead to this idea of suspicion. A person has an empty wallet and they're assuming they had more money before. Person forgets that they moved an item from another place, and then finally the caregiver moves it when cleaning, and there's some suspicion there as well, right? So let's look at the scenario. Clara is 85 years old and living with Alzheimer's disease. She's living with her daughter, Irene. Recently, Clara had been nervously walking around the house. She looks out all the windows in the afternoons. She'll often tell Irene, "Those people are out there again. They came in here last night and they took my purse." Irene tells Clara that no one has broken in and her purse is in the closet. However, Clara keeps walking around the house and is becoming even more upset. So think about everything that happened in that little ditty I just gave you. And let's look at some good solutions here. So how can Irene help with emotional needs when Clara has these suspicions and delusions? We'd like you to pick 2 of the 3 that are on the slide here. This one's a toughie to me because sometimes you can work on 2 and 3, and that even doesn't work. So you say to yourself, maybe let's redirect here. And we do this with young children too, don't we? Where we say, let's redirect for now, and maybe we can revisit this in the future. So I don't think any one of these is really problematic as long as you're careful and kind about the redirection. The answer is here, 2 and 3. So I'm going to click those off. And we'll look at the explanation on the next page. So in this example, Irene can listen carefully and tell Clara that she is taking the problem seriously. I almost feel like you could do that and then redirect, right? So really a combination of those 2 there, right? She can also reassure Clara that she's safe and offer to check all the locks in the house for her. So again, a redirection might not be the first place to go, but certainly a combination of those 2 could be helpful. Okay, and then finally, we're going to look at getting lost and wandering. So oftentimes, wandering can happen when folks are having feelings of discomfort and restlessness. As I said to you before, sitting for too long and thinking about things that conjure up, oh, I'm going to go find blah, 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 and see if they want to do something, right? And so even feeling discomfort while they're seated, maybe I need to get myself out of this environment and I'm going to wander, right? Even feeling bored or unmet needs. Like, I really need to go to the restroom. There's nobody here right now. I'm going to try to find the bathroom. And the door that they choose is the door to go outside, and off they go, right? So again, these are causes for wandering. So here's our last step 4, review and plan the next time. Here is what they've given us to ponder. Mei Ling is 69 years old and living with Alzheimer's disease. She lives with her son, Kenji, his wife, and their 2 young children. Mei Ling ran her own flower shop before she retired, and Kenji starts to notice that Mei Ling walks back and forth when she's in the yard and she seems anxious. Once she tried to leave the yard when the family was outside with her. She tried to go into the neighbor's garden. All right, so as we look at this last step, since there is a chance she might try to leave the yard again, how can Mei Ling's family plan for the next time this might happen? If you're observing all of this and you're saying, wow, we better put some safeguards up because this could happen, this is a great time to think about it, isn't there? Okay, so of the 4 options you've been given, please select 3 of the best tips that apply. Anything in the chat box, Amanda?
Yep, at home we have consensus on 1, 3, and 4.
Yeah, what did you think in here? Right. So avoiding letting her be outside when she just obviously loves the garden and the flowers. Think about some scenarios, maybe plant some new flowers in your own yard, even with Mei Ling, or maybe shop with Mei Ling to say, what colors do you like? And then give the neighbor a heads up saying, we're having a few issues over here. Be very honest, because you want them to feel as much a part of what could be helpful to you as a family as possible. And then again, support her while she's outside and keep an eye on things because of the fact that she may try to leave the yard again, but certainly don't stop her from going into an environment that could be incredibly joyful to her and often bring back some very good memories for her. Okay, so those are the things that we chose, and it looks like we did well. So let's listen to this caregiver. If you've seen this individual in sessions in the past, she talks about actually having a spouse who had dementia along with a father who had dementia. So in many situations, she refers to both of those. So here, let's listen to what she has to say.
While caregiving for my dad, I realized that one of the behaviors that he had related to his dementia was wandering. He would often feel restless and want to leave the house, sometimes at 5 in the morning, sometimes at 8 o'clock at night, or just at any point throughout the day. And at first I was very frustrated by this behavior and just would constantly tell him, Dad, you can't go out right now. We're not going out right now. But I realized over time that that was not working. And rather than telling my dad what he couldn't do, I had to put things into place, telling him what he could do, offering him a structured schedule, activities that were not overstimulating, and a schedule that really promoted him feeling calm and engaged throughout the day. Once I started doing this, it really helped to reduce the wandering.
Okay, so some good suggestions. And when I think about some of the suggestions that she did have for us, we kind of insert those things in lifelong learning, right? So when a person is constantly doing something that they can't do, we get real tired of telling them you can't do it. Even a teenager, even a young adult, right? So we often say these things and then we say to ourselves, perhaps they don't know what their option is. So let's plant some seeds for better options. So telling them what they can do is certainly something that we've learned throughout life is a good option instead of saying no, no, no all the time. Okay, so that was our 4-step approach as we moved through those. As we move through those steps, I hope you could relate to some of the little ditties or scenarios that they gave us where we could, in fact, kind of almost insert ourselves to say, boy, if this happens to me next, I'm going to try some of these things. Or it wasn't quite this that happened, but it sure was similar, and I might be able to help myself out or the situation out a little bit better here. Finally, we want to talk about some medical approaches to dementia-related behaviors. So just know that oftentimes these triggers are because of there's a medical need that needs to be met as well. Okay, so as we said a few minutes ago, maybe someone fell and we didn't investigate them carefully enough, and actually you look at them after you're helping to get them dressed and you see they've got a huge bruise on your back and you don't know where it came from. You say to yourself, oh my goodness, this could have been the source of all of this and I just didn't know. And so this idea of really checking a person out and making sure that you've gotten them taken care of medically if they need it is another good first step. Okay, so know too that drug side effects from prescription drugs can certainly affect behaviors. So look at that drug interaction. Maybe you give a drug to an individual that's prescribed, or your doctor has said, try this, and it's really not working. Make sure you're kind of journaling those things. You know, I gave this drug and 2 hours later, you know, the train came off the tracks for us. And it seems like that happens every time I give this combination of drugs to the individual. So journal that a little bit, because I have to say, when you do go to a doctor's appointment for yourself or with another individual that you care for, there's so much you want to convey that if you don't stick with your journal, you might either forget something or it doesn't become too cumbersome. You're sticking to the script here and you're trying to get answers for those things that are important to you as you move forward with this individual. They may have discomfort from infections or other conditions. As I mentioned to you earlier, a UTI is a big one here. It's very hard to express that to somebody, but anybody that's on the call or the meeting here today who's experienced that feeling, it's terrible. It's a terrible, urgent feeling that you want to get taken care of. So again, is it something physical that needs to be addressed? Is there an infection in the body, an earache, a continuing headache, a UTI, or a very sore throat? And because they're not very vocal with you, you're not sure what's happening with them. Okay, so again, keep that in mind too. And then uncorrected hearing or vision problems. So as we progress through the disease and as we get older as a general population, I hate to say it, but there's 3 of us in the room here that are participating in the webinar, and all 3 of us have glasses on. So we all have vision correction issues, right? So as somebody who has dementia and can't express that to you and is already feeling like they might be hallucinating or whatever the case may be, so be sure you're checking vision and hearing, because if I can't hear well and I can't see well, I can conjure up all kinds of things that are happening that don't even exist. So it's really important for us to look medically at confusion, frustration, and feeling alone when you feel isolated because you can't hear or see anything. Okay, so those are things that we keep up on. If you get your eyes checked every year, then this individual should do the same. Okay. Okay, and then when we think about medication, so talk to the doctor if you think there is a medical problem. The doctor can decide if this person needs additional medication or if the maintenance of medication this individual's already been given is perhaps not working correctly, or if they need to investigate it further. Okay, some doctors may prescribe an antipsychotic medication. This is to reduce and control symptoms of delusions and hallucinations. So again, once somebody might be prescribed this, you're going to also be looking after a new drug is introduced to see if it's really helping or hurting, or do we need to manage this better? Is the dosage wrong? This is another area of a lot of observation. And then always talk with the doctor about the risks and benefits of any medications before making a decision to use them. So all medications have risks, and it's up to you to decide with your doctor if the risk is worth the benefit of the drug to you. And actually, that's the method that all doctors should be using in terms of prescribing for a patient. Okay, so the activity or the handout that I discussed that Amanda has, she has sent you the PDF or whatever the file is. I think it's in a PDF form. But I do want to take a walk through it with you just to show you what it looks like if you don't have it pulled up or you haven't had time to open it up. This actually gives you a little bit more and a companion to the information we learned together today. So it actually gives you a little scenario of Manuel's story below about he and his wife Olivia and the 4-step approach, okay? Also, underneath, it tells you how the 4-step approach was inserted here and used to help solve or remedy what was going on in the situation. And then it asks you to think about how you can apply these best practices to your own situations. So you'll write down one dementia-related behavior that the person who you're caring for is experiencing often, or maybe it came up one day. Again, it asks you to use the 4-step approach to help you with the potential causes, how you can remedy, how you might respond. And here is a great explanation of the 4 approaches, what they entail, and how you can go through them and apply them to situations that are happening in your household that are difficult for you to manage, okay? And honestly, many of these situations you can apply for other things as well. I think it's just a nice way for you to look at situations you might be having difficulty speaking with children. Sometimes they don't want to embrace the fact that we're going through this. This is a diagnosis. This is what's happening. And so oftentimes even looking at this approach to talk to children about what's going on with perhaps their father or their grandfather is a good starting point as well. Okay. And we also know that additional help may be needed. And so we want you to think about the fact that behaviors can be stressful no matter how well you see these approaches, and that when you're the caregiver, this falls on you quite a bit. And emotionally, you may need a break. You may need to see who else you can seek help from. Dementia-related behaviors may be more severe and happen more often as the disease progresses. So again, what safeguards are you putting in place for yourself? Do you say to an individual, I'd love to have some help, and they say, I can't right now, my schedule, it's tax season, and my schedule's super busy. Don't forget to say, I'm going to reach out to you again after tax season to see if perhaps you're available to support, okay? Or take them up on anything they'll offer you. They might say, I'm going to the grocery store, do you need anything? And instead of saying, no, I got this, say, I'd love it. Let me make a list. I'll give you some money and we'll square that away, together. All right. Or can I stop by for an hour? And you're saying, well, I don't know. It's not a good hour for me. No, maybe just step to another room and have another person come in and be there to care. So think about how you can accept help for yourselves. When behaviors become too much for your emotional and physical health, it's time for you to talk to the doctor about what you can do for more support for you, okay? You're only as good a caregiver as you are to yourself. And remember that self-care is not selfish, okay? So think about that as well. And you also have to always be worried that everyone in the house is safe. So once you start noticing behaviors that compromise the safety of the individuals in the household, including the individual who's been diagnosed, this is where you have to get super serious about things, okay? So this guide tells you a little bit about home safety. So if there are any firearms or weapons in the house, remember that suspicion or delusions or aggression can become quite dangerous if those are accessible to this individual. So to prevent these accidents from happening, you should seriously think about removing them, putting them in a cabinet, a lock cabinet, a safe. We're even talking about serious knives that we might use to, chop and so forth. But if you're noticing a lot of safety issues and a reason why you should be concerned about those things, then you should be proactive and think about that on the front end. And if the safety of the person living with Alzheimer's, you as a caregiver, or any other individual in the household is at risk, please call 911. But make sure you tell the police or the folks that are arriving to your home, even if you call them for an incident like a fall or something, make sure they know that the person in your household that they're going to be treating or addressing has been diagnosed with dementia, so that they can be prepared on the front end of this when they come to your home. We also want to share with you all the Alzheimer's resources. And as I talked to Amanda on the front end of this presentation, she's very good to share all those things with you, let you know where our previous recordings are. Honestly, you should be joining all of the recordings for everything that they present here at IU Northwest and Cure, simply because they are really informational sessions that you can benefit from. If you choose to go another route, the Alzheimer's Association has lots of resources for support. I've talked to people who have really very successfully used the 24/7 hotline, the 800-272-3900 number, simply because they wanted to talk to someone. They didn't want to peruse the website to try to figure out what it is that they wanted to find. These are master's level clinicians. They are there 24/7, and in one of the presentations I do, there's a gentleman who speaks about just calling during the middle of the night because it was only time that things settled down in the household. He was awake with lots going through his mind, and he would regularly call the hotline in the middle of the night and always felt very good about the support he was getting through the phone line. Okay. Also, maybe you want to join a support group or find out more about the local chapter here in our area. Again, the box at the top that says local resources, you can go to alz.org/find us, and you can find some chapters and support groups in our area. You can even call the helpline and say, this is my zip code. What do you have to offer me here? There is an online piece too about care, safety, and when we successfully stop driving, because those are hard conversations with folks. So you can also visit alz.org for that information. And just know too that Amanda and I are partnering to provide more educational programs. We have one more left in this series, and I hope you join us for it. And so with that, I'm going to see if we have any questions or concerns.
Thank you, Linda. For our first question, the participant notes that the terms dementia and Alzheimer's are both used throughout the presentation. But can you explain the differences between these terms and/or how they are related? So if I were to put an umbrella over my head and I could label that umbrella dementia. Alzheimer's is a type of dementia, and it's the most frequently diagnosed type of dementia. But you can even have a number of different types of dementia all at the same time. So I try to do that umbrella term. This is the Alzheimer's Association, but many of the characteristics that we speak about, especially dementia-related symptoms and behaviors, it covers all of those in that umbrella, okay? Yes, Linda, we have a participant who has commented on the term sandwich generation with reference to people who are caring for parents potentially with dementia while also having to care for people younger than them, children at home. So they're sandwiched between an older generation and a younger generation. I appreciate you mentioning that, and that term has actually been around for a while. And it's not just that I might be caring for parents. My mother-in-law right now, she's in home hospice. My mom is 90 and she had a knee replaced this week. So I might be sandwiched between those two helping out, but I also might be sandwiched in the fact that I still have children living at home. I don't currently, but let's say I did. So I might be sandwiched into caring for my parents as well as my own children. So now I'm sandwiched in there, right? So there's lots of ways that we're being sandwiched. And I have to say, I have to recognize some folks who are early onset,
So let's say I'm 55 and I've got a spouse who has been diagnosed with early onset dementia. Now I'm in a situation where parents need to be cared for. I have very young children, and financially I'm having trouble because I can't keep my job after a while. And so there's another scenario that's very difficult for folks, and it certainly is a difficult sandwich as well. So I appreciate your comment. You are absolutely correct. That is a term that we've been using when you're kind of sandwiched between where you're needed to provide support.
Thank you so much, Linda, for another spectacular presentation. We always appreciate you coming and spending time with us. Thank you so much.